Trigeminal neuralgia is an invalidating, painful pathology. Often, the pharmacological therapy is not able to control the painful crisis. Surgical procedures can be used. Among percutaneous techniques, thermorizotomy is the most precise intervention. It allows the exact localization of the fibres coming from the various trigeminal branches and a certain graduation of the depth of the lesion. We will see in this video a procedure of trigeminal thermorizotomy. After the preparation of the sterile operating field, the needle is positioned under radiological guidance until the oval foramen is reached. The patient undergoes mild sedation with short-acting drugs. Reaching the oval foramen and the trigeminal cistern is confirmed by the release of cerebral spinal fluid from the needle. Subsequently, millimetric adjustments of the needle allow the achievement of the target of the thermorizotomy, the retro-Gasserian route. Place the needle in the trigeminal compartment. Insert the electrode and wake the patient to perform neurophysiological tests. After complete awakening, with the patient conscious and cooperating, we proceed to sensory electrostimulation with a current of about 50 Hertz. This current evokes paresthesias on the facial territory, metamerically correlated with the stimulated fibres. More simply, the patient will have to perceive the paresthesias like a sensation of pleasant tingling, exclusively in the zone of the face that normally is hit from the painful discharge. Radiological guidance, impedance readings, and sensory tests thus allow for a correct and selective thermorizotomy. Once the correct positioning of the needle electrode has been verified, comforted by the radiological and neurophysiological findings, we proceed to the lesion. Considering that the stimulus induced by lesion could be extremely painful, we proceed first to sedate the patient with short-acting drugs, as previously performed during needle placement. The injury is normally performed with a temperature of 70 degrees for the duration of about 60 seconds. Often, during the lesion, there is an appearance of facial redness. Performed the first lesion, we wait for the complete awakening of the patient. Then we proceed to the examination of the painful tactile sensibility as well as of the corneal reflex. If sufficient hypalgesia is not found, the neurostimulation tests are repeated and the correct positioning of the needle electrode is verified and the new lesion is performed. The objective of trigeminal thermorizotomy is analgesia or hypalgesia in the facial territory affected by trigeminal neuralgia. More simply, the patient should feel in the affected facial territory a slight numbness of the face. Once the level of hypalgesia is sufficient, the needle is removed and the procedure can be considered completed.